Hello, my friends. Welcome to a new interview, Vocile 2.0. Today we will talk about Signant Health with the CEO of this company, Mike Nolte. Mr. Nolte, thank you for being with us and receiving us here at the Signant Health office in Iași, Romania.
That's great. Thank you. Thank you for taking the time with us.
Let's start. The first question is a challenge.
Okay.
If you would, in the front of a man from 19th century, and you should tell him what Signant Health do or make,
all right.
How would you do it?
Okay. We'd probably start by trying not to explain computers and technology to him. What we do is we help companies develop new medicines for healthcare, to take care of people using new medications and to test them using technology. And we do that really through helping to collect and manage data associated with experiments and trials to develop those new medicines.
A medicine for the future.
Yes, for the future.
Long
way in the future, right? Using iPads and PCs and the web and the cloud, but it would take a long time to explain all that to somebody in the 19th century.
Now, Mr. Nolte, where are you and your company a year on from the merger that created Signant Health?
Yeah, it's interesting. We've done a lot of work, and we've done things like integrate commercial teams and operational teams and service teams. But the thing I'm most proud of is we've worked very hard to build a unique and specific culture around this new business. We brought together two very interesting businesses, CRF Health and Bracket, to form what's now Signant Health. And it's been a challenge, as you can imagine, to try to bring those new teams together and help develop a single view across the globe in places as diverse as Romania and Tokyo, where people feel like they're part of one company. And we've spent a lot of time working on that specifically, and that's been a lot of fun. We are through most of the hard work of how we're organized and how we serve customers. A few hangover things. We're still on 2 general ledgers as an example, because we had to wait till we got through an audit for that. But most of the things are pretty much complete. So culture is the thing we'll continue to work on for, frankly, a long time in the future.
So it's no longer a work in progress. It's done.
Yeah, done with the exception, I would say, of culture and a few system hangover type things. We're working through some other things around the margins, but pretty small stuff left. So.
Okay. What does the year look in review for the clinical research industry?
Yeah, it's been interesting. We're seeing a lot of acceleration in what people variously call virtual trials, hybrid trials, siteless trials. Sometimes I heard it as distributed trials, but what it essentially means is that clinical research, which is the industry that we're in, supporting that industry with technology and services, has typically been mostly done in what are called sites, which just basically means a clinic or a hospital where clinical research is conducted. And what that means is that patients have to travel, in some cases, a long way in order to participate in a clinical study. And depending on the patient, they may have an oncology, be participating in an oncology trial, which means they have cancer. And so, they're very interested in new therapies and new opportunities to try to cure disease. And so one of the things we've seen that's very interesting and that we are beginning to engage more directly with our customers in is the ability to connect with those same patients remotely. And that's through using some fairly simple technologies to gather data, but also, things like telemedicine, which just means the ability to have a conversation with somebody using a video. It's the same thing as a typical iPhone video chat or things that most people are familiar with, but using sort of high resolution video to look at clinical outcomes or to look at a dermatology issue on somebody's skin, to be able to see that and have a conversation around it. And so there's a lot of work going on that's very interesting that we're heavily engaged in to be able to support those kinds of very different trials. And it's cool because it expands the universe of people who can potentially participate in trials down the road. So.
In your opinion and from your experience, what trends are making the biggest impact on the business in Romania?
Yeah, I think in Romania specifically, right, we are working hard to, just like around the globe, support clinical research through technology. And this industry, for lots of good reasons, is very risk averse, right? It's not a typical industry in terms of the adoption of technology. I always say it moves at the pace of risk, not the pace of innovation, because our customers make significant investments in clinical research. And what that means is any change, right, in the way trials are managed or the way data is captured or the way they communicate with patients means that introduces new risks. And so all of that is managed very carefully by our customers. And so we're working very hard in Romania and elsewhere to begin to help move our customers more forward in adopting the kinds of technologies I described. And that, look, it's everything from devices, so how you collect data through everything from a smartwatch to a blood glucometer, which is something to measure blood sugar, or a simple scale to measure weight. All of those things are endpoints or data that can be collected in a way that doesn't involve that patient, again, coming into a site to have a traditional interaction. And then there's services that go alongside that as well that allow things like specimen collection and all of the logistics and supply chain that's required to track delivery of drug, collection of specimens, and other activities that are associated with clinical research. And there's nothing about that change that's unique to Romania. It's pretty much a global phenomenon, but we have unique opportunities here because we're here, right? Because we have an investment and a specific presence here to help to actively manage it in a country where I think there's a lot of opportunity. So.
Everything you tell us looks like a revolution in the clinical industry.
Sure.
All right, it's something disruptive.
Yeah, I think disruption is a difficult challenge in this industry. I think there are some very interesting potentially disruptive technologies, but the adoption of our customers will be relatively moderate. It would be my argument, and it's for the reasons I suggested. But we certainly are looking at things like artificial intelligence and machine learning and ways to use data and analyze it in different ways so that we can accelerate the clinical research that we support. Our whole focus as a business really is around trying to focus on the patient first. And the reason we do that is because we believe that fundamentally, if we do that, it has a knock-on benefit to everyone else, right? So if we can make the patient's experience simpler, give them more time back, right, to spend with their families and to spend outside of a clinical trial, that creates an opportunity for sites to move more quickly. It creates simplicity in the supply chain. It requires everything else around that clinical research study to be more efficient, right? And so we're very focused on the patient at the center because it matters certainly to our customers, but it should matter to us too, right? It's the work we do on behalf of our customers benefits my friends, my family, my community. It benefits Romania, the United States, Japan. It's sort of a global benefit potentially, and frankly, you and I have the potential to be a patient someday, and so we should hope that the work that we do is successful and efficient and effective as well. So,
actually, I have another question coming about patients.
Okay,
and,
sure. Yeah, great.
You may be able to speak again about that in a few moments. But now I'd like to ask you about what are some things as a global company that Signant Health is pursuing in the future?
Yeah, so a couple of very specific places where we're investing. One is in device connectivity. We see we provide a solution that's called ECOA, it stands for Electronic Clinical Outcomes Assessment, and it's essentially a data gathering device that either clinical sites or patients use directly, right? Capturing everything from assessments to side effects, right? I'm participating in a clinical trial and I've got a headache, or I'm gaining weight, or I feel sleepy, right? It's the stuff that's around the clinical trial to help manage what the drug's doing and making sure that it also captures the things that are unintended that sometimes happen with drugs. That solution is really a data gathering device today, and it requires patient input in a lot of cases. And so we're looking for ways to make that more active through device connectivity. We recently signed a partnership, as an example, with a business called Actigraph, which measures activity, right? And activity is an important part of measuring many aspects of clinical research because fatigue is often a common side effect, as one example of taking some drugs. Also, there are drugs that are intended specifically to manage certain kinds of diseases that have unusual activity, right? So gait, the way you walk, is a good example of a condition for some particularly neurological conditions. And so, how that improves measured by a device can be important in measuring whether the drug is successful or not. And so that's one area. The other big area for us is how we gain insight into making the clinical trial successful, again, from that patient perspective. So thinking about start to finish, what data can we gather, reproduce for our customers, analyze using things like machine learning to better understand what's actually going on in the context of clinical research. And that could be sites that are recruiting more patients. So, a site in Romania is able to recruit patients more quickly than a site in the United States. Or it could be performance of sites. Sometimes there's complexity in the way certain disease conditions in the context of a trial are measured, and that's something called scales. But think of it as a maybe you've been to the hospital and you've seen a pain scale, right? Where they'll say are you feeling pain, and you say yes, and then they'll give you a sort of sad face to happy face, and you say it's excruciating to it's actually not too bad. That's an oversimplification, but those kinds of scales in a more complex form to measure certain kinds of diseases or endpoint mean that there's variability in the way people use them. And so another thing we are actively doing is being able to measure data and look at a site and say, are they using those scales appropriately, right? And again, usually for more complex conditions like Parkinson's disease, as an example, or Alzheimer's, where people have cognitive challenges, and so measuring whether somebody's getting better or worse who has Alzheimer's or Parkinson's is difficult, right? And so it's important to take a look at the data and understand how well the clinicians that are involved in those studies are measuring data. Those are just a couple areas where we're investing. But
listening to your explanations, we understand better how important is collecting data.
Sure. Yes.
For this industry.
Yeah, absolutely.
The question about patient.
Sure.
What developments in patient-centric clinical trials will most benefit the patient, and what does it mean to be patient-centric?
Yeah, I think the two kind of go together. I think I look at it very simply as if I'm a patient participating in clinical research, there's basically three reasons that I'm participating, right? One is altruism, meaning I'm participating because I believe it will deliver a benefit to society. That's more common than you might imagine. There are people who do that because they believe strongly that they may be able to help somebody else with the condition that they have. Second is money. There are certain kinds of conditions where you run clinical trials. The flu is a good example, right? Where mostly people participate because there's an economic benefit. If I'm going to give you the flu, which is what happens in that sort of a clinical trial, you probably want some economic benefit for having the flu on purpose, right? So that I can test a vaccine, as an example. And then the third is it can be a last resort, right? Somebody with a chronic condition where unfortunately they know that the end of the chronic condition means that they're probably going to pass away, right? And so they're looking for the opportunity to find a cure for whatever condition they have. Cancer is probably the most common example, but there are certainly others. And what they need more than anything is time, right? And every minute that they spend in clinical research is a minute they're not doing something else, right? And I, feel very passionately that I would prefer that they spend time with their families and their friends and whatever else they do outside of participating in a clinical trial, because they may not have that many hours or that many days left to do that. And so that's sort of the starting point for me. In terms of where we think we can make advances there, it really has to do with just rethinking the whole model. And by the way, this is going on in clinical care as well, but using telecommunication differently so that you can have a conversation with somebody remotely, using high resolution imagery as a way to assess what's really going on, with could be everything from a skin condition to somebody's gait to something that's going on with an orthopedic problem to even assessing, some complex things like, again, Parkinson's or Alzheimer's or schizophrenia or other neurological diseases. So, the opportunity to see into the window of somebody's life, but to be able to do it without having to sit physically in front of them in a clinic. We're looking for lots of opportunities to be able to do that. And then, lastly, I think it's coordinating all of the logistics that are associated with being able to support a remote location, right? And you've got to be able to get the drug there, right? And we provide solutions that manage clinical drug delivery, as an example. You have to be able to collect and manage complex logistics, also sometimes around samples, right? So you may need to produce a urine sample, as an example, and how you ultimately get that back to a site so that they can analyze it is challenging, right? And I think the coordination and expertise required to do that is complex, and we have, as I said, a risk-averse customer base. But where I see that opportunity is just always asking the question: can I further simplify the patient's experience, because time is important to them, and if I'm focused on that, I should create an economic benefit for my customers because they'll be moving more simply and more quickly, and ideally, I leverage technology as a way to do that.
We're not done yet, Mr. Nolte. Thank you for being so involved in this conversation.
Yeah, sure.
I have a few more questions. What technology advances can we get excited about with Signant?
Yeah, where we are investing largely has to do with better analysis of data, so artificial intelligence and machine learning, which I mentioned already. The other really exciting place that we're beginning to grow a part of our business is around something called electronic consenting. At the front end of a clinical trial, if you or I are going to go participate in one, we're going to go through something called a consenting process in just about every country around the globe. And it's different depending on location and the regulatory body that you might be involved in. So the United States would look a little bit different than Romania, as an example, and would look different than Japan, and would look different from India. But there's some process usually. And what it is it's designed to make sure that you understand the trial before you enter into it, right? So I mentioned the flu example, that that I'm going to give you flu, right, as part of it, right? If you already have cancer, you understand what cancer is about, but you may not know the risks of the drug. You may not know what's required in terms of how many times you have to visit the site. That could be a geographical hardship for you. People sometimes travel many, many miles to participate in oncology research in particular because of the last resort nature of it. And so understanding how many times you have to do that, and the fact that you might have to have a family member accompany you, and what the risks of the drug are, and how long you have to take the drug for, and how complex it is, and what side effects it can cause. All of that can be very, very complicated, and protocols, which are essentially the activity or the regimen that is being tested in the clinical trial, change from time to time. And every time it changes, you have to re-consent, or you have to go through the consenting process again. And so that can become, from a paperwork, a patient engagement, and a complexity perspective, pretty challenging. And so we provide a solution that we are engaging with customers on to be able to manage all of that digitally, right? So that you can do it remotely, so that you can do it in a way where you don't necessarily have to go through a bunch of paperwork over and over again. And probably just as importantly, it uses video, rich text, imagery, and lots of other mechanisms electronically, just like you're kind of browsing a website, to be able to give you more context, right? So you can see and visualize what the trial is really going to be about, and why that may or may not be something that you would want to participate in, so that you know what you're consenting to. And so that's a pretty interesting investment that we've made more recently. And we're continuing to move down the path with other areas. Another area that we're very interested in is patient recruiting. It's a bit of a mess, so how and why and when patients get into a clinical trial is a little bit it's a lot of small businesses who are essentially keeping databases of physicians and patients and work hard to try to get enough patients so that the trial can be successful. And we think there's some interesting technology solutions that might help solve some of those challenges as well. So there's just a couple areas that we're thinking about.
What can you tell me about the investment plans for Romania?
Yeah, I mean, the best example I could give you is this office, right? You could walk the halls here and you'll see pretty quickly this, these floors, when the first time I visited, and that was only a year ago, we merged with CRF and Bracket about a year ago, and it was the first time I had the chance to visit here. It was sort of half empty, parts of this building, and now we're literally bursting at the seams. So, we have big plans to continue to invest here. We think there's a great body of talent here, lots of great people who fit the model for what we're looking for in terms of people who can help us to be successful. And we want to continue to grow our footprint here. Our biggest problem right now is we're just running out of space. I think we're getting close to 300 people here in this office space, and that's out of a company, just to give you some idea, that's only about 1,800. So it's a pretty significant investment, and this is about to become our largest office.
We should build something for you.
Yeah, exactly. Yeah. So it's interesting. If you have good real estate ideas, let me know. But this is we love this location. It's unique for many reasons, which is one is we are, unlike many of the businesses who are technology focused here, we are very focused on one business, right? This is our team. We are not doing outsourcing. We're not providing services to other businesses. They are part of our company, and that's a relatively unique business in this area. The other thing is, Yash is about the right size for us. We're not overwhelmed by very large companies who have really large operations, and so we're a relatively well-known business here, which is phenomenal, right? And we've got great access to universities and great talent here, and it's been a pleasure to be able to spend time here as well. I love coming back here as well. So,
can you give us some tips for recruitment in Romania? What can the local academic routes look to offer in training and development?
Yeah, the two big skills that we look for, right, are probably no surprise. So one is software engineering expertise. Like, we're always looking for great engineers, and so the ability to produce new graduates who have that capability and are talented and want to work in an innovative company that has a unique mission. That's a huge win for us. The other area is, it's really project management skills. It's sort of project thinking, and that's I would say probably less common in most academic curricula. But when we can find that skill set, when people have had experiences either through an internship or some other experience in their educational background, it's a huge asset for us, because we manage very, very complex work for our clients, and it requires a disciplined level of thinking that is, it's not unique, but it's certainly a requirement of being successful here.
Mr. Nolte, these was my questions for you. Thank you for
Thank you. Yeah, I appreciate it.
Answers and for the interview. My friends, I'm Ovidiu Mihaiuc. We will see you next time at Vocile 2.0. See you soon.